Iron again at PA Fitness in Arlington. The gym reopened this morning in direct defiance of the governor's stay home, stay healthy order. The owner told KOMO's Michelle Esteban that he believes his business is essential, but tonight the state is already pushing back.
Our constitutional rights are being violated so badly.
Mike Jellison considers his Arlington gym an essential business. Dozens of his members who showed up today echoed what he insists, that working out at their gym is essential to their physical and mental well-being.
I think it's an essential business.
It feels great to get back into the gym. It's for my mental health and clarity. It just is good to get out and work out some of that stress that's been building, that's been put on us over this whole COVID thing.
I'm defying the governor's order, but the governor's order is not a law.
And Jellison said he reopened after adding safety measures.
All right, you're free to go to the front desk.
A temperature screening station at the door, social distancing spaces, half the equipment removed to make space, and machines disinfected before and after use.
What are you going to do if somebody gets COVID and it's traced back to here, or somebody they came in contact with?
You are an adult, and as an adult gets to make an adult decision. Either you decide to come in or you decide to not come in.
I wanted to know what the governor thought. His staff said he wasn't available, but that businesses out of compliance, quote unquote, will likely be issued a citation. But by late this afternoon, we found out exactly how the governor feels. Jellison got an email notifying the gym it was out of compliance. He was surprised by how quickly that happened, but told me he had nothing else to lose by opening other than his livelihood.
We're talking about 60 people in a 20,000 square foot facility. 60 people. Do the math. There's plenty of space.
A new King County directive strongly urging everyone to wear a face covering in public places. Officials call this a precarious moment, saying we need to keep the virus from bouncing back as the state begins to loosen restrictions.
The directive that takes effect 1 week from today calls for people to cover their mouth and nose indoors in public places like a grocery store. It also applies to outdoor areas where it's difficult to stay at least 6 feet apart from other people. Now, this directive is voluntary and will not be enforced. KOMO's Joel Marino's live in Seattle with the push to cover up. Joel?
Mary, it is a real mix when you venture out as to whether people are wearing masks or not. Now, though, with this new directive, a lot more stores could be posting signs, and this request to mask up will really be in people's faces. When it comes to wearing masks, some people do, but a lot of others don't. Now, King County is asking that masks become the new routine when people are out in public, especially indoors.
It's worth it. It saves lives. I'm going to put mine back on.
Masks have become a flashpoint of sorts and a new source of social pressure.
I mean, yeah, every once in a while, walking down the street wearing a mask, people kind of sometimes look at you funny.
And then there's people who say they wear masks but don't want to be told that they have to.
I think people should be able to do what they want to do in this situation.
Unlike King County, the Snohomish Health District has no formal policy, but says cloth face coverings are strongly recommended. The Tacoma Pierce County Health Department says it's your choice to wear a homemade mask. Consider this step when you can't safely social distance or are in public settings. Masks can also create some unintended challenges. A furniture store owner says he checks IDs for customers who prepay and then come down for curbside pickup. But masks could make that verification difficult.
You don't want someone to take off their mask so you can see that they match up. But if enough of the details are there, I think you just kind of have to go with it.
The 35-year-old man who medics rushed to Providence Regional Medical Center in Everett on January 20th probably wasn't the only person in America with COVID-19. But he was the first doctors know about. The man had just come back from Wuhan, China. Nurses suited up in protective gear to care for him inside an isolation unit, and a team of contact tracers started searching for the people he'd crossed paths with since arriving at SeaTac.
The contagiousness probably precedes the first symptoms by a day or two.
Contact tracing starts with patient 0. Investigators then try to reach everyone the infected person interacted with while contagious. Backtracking can mean calls to airlines, restaurants, shopping centers. In extreme cases, surveillance tapes might be checked. Public Health traced dozens of people who had had close contact with patient 0.
Didn't find any secondary cases there.
Health officials assured the public the risk was low. Dr. Chris Spitter says no one realized the virus had gotten loose before that first patient was isolated.
We tried to control the one that we had our hands on, and we thought we had it, but Obviously, the facts have shown otherwise.
At that point, public health stopped most contact tracing because the disease had gone too far.
Once that virus spread from that initial traveler unrecognized, it could have gone in any direction because nobody knows, it was spreading silently.
Public health experts went from downplaying the risk to begging people to avoid all human contact. But contact tracing will reemerge, and combined with widespread testing, will be key to reopening society. To lift social distancing measures like school closures and stay-home orders, public health agencies will have to start contact tracing at a much higher level than they were a few months ago. Contact tracing will help us move from mass quarantines to targeted groups of people who are tracked down and isolated to keep the virus from exploding into new outbreaks.
You're trying to draw a circle around anyone with that illness.
State health officials are adding hundreds more contact tracers and tapping the National Guard to do much of the early legwork. A recent report by Johns Hopkins Center for Health Security says closer to 100,000 contact tracers will be needed nationwide. Testing also has to ramp up to about 30,000 a day.
We all have a big challenge ahead of us.
This entire community mobilized to find little Athena. Her mom says as soon as she went missing, her neighbors didn't hesitate to go find her. And for that, she's very thankful.
You want to say hi?
A mom relieved to hold her baby girl. For 4 agonizing hours, Kimmy Simmons thought it wouldn't happen again.
So I just hope nothing like this ever happens again, like even if she is just sleeping, because I don't know if my nerves can handle it.
Her 3-year-old daughter, Athena, had vanished from her room where she usually plays.
Your heart stopped beating. You don't remember how to breathe. You just hope that she's okay and that you're gonna find her.
As soon as Kimmy sounded the alarm, the entire neighborhood mobilized. Hundreds of people in droves and by the carloads, some combing the nearby woods, all looking for her.
You just want her back and you just want to hold her.
Then, as Kimmy's sister was looking through different rooms for her baby's change of clothes, she pulled a blanket from the bed, and there she was.
You have a good nap, baby.
Little Athena napping under the blankets, sleeping through all the commotion. Her mom now sharing this message to other parents.
Always be aware. Just try to always be aware.
And Kimmy says she's also definitely getting surveillance cameras to put around their house.